Hello, I welcome you in this short video talk on on a topic called why should an MBA student or all MBA students should be exposed to the concept of evidence-based management. The phrase evidence-based management has come from evidence-based medicine, which has been coined evidence-based management in 1990s. And we have seen that why people are copying that evidence-based management from evidence-based medicine, because in evidence-based medicine or in medicine as such, before evidence-based medicine also, not a single medicine could come to the market without a trial, scientifically trial, unbiased trial, and generally in this case it is RCT, randomized controlled trial. Then it is published in a journal which is peer reviewed, then judged by an expert committee, then the drug is approved for consumption and become a prescription drug. Such things does not happen in management. Now, what is the similarity between the medicine and the management? In the management also we have got lot of tools and techniques in all areas, and those tools and techniques, when it has been applied in a particular organization and it has been accepted based on generally by big stories by high profile executives, given by executives or high profile consultants, and there are books written on it, and we take it granted, and we have done it. And we have seen there are many in the past which does not exist today. So management, a group of management experts, academicians, they initiated the movement of evidence-based management. Now, what is evidence in evidence-based management? Evidence is an information which can be verified, which supports a claim. That's an evidence. If I talk about that, quality circle. So, what is evidence? There must be an evidence that says that companies deployed quality circle must be performing better than the companies do not have quality circle. We don't see, there are hardly any evidence. We have seen many, techniques which is known as this flow of techniques, or even in academic literature it has been termed as fads and fashions. We have seen many fads. Management by objective, we don't hear about it nowadays. Sensitivity training, we don't listen about it. Quality circle, hardly we see people talking about it. Total quality management, people don't talk. Instead of total quality management, people talk about business excellence model, which they claim is the total quality management. But here also, what is the evidence? There is no such concrete evidence. Let's take a case of one model which is the mother of all excellence models, is Malcolm Baldrige National Quality Award. It was launched in 1979 in order to motivate the US manufacturing industries to perform better. Encouragement, giving them encouragement, motivating them. But nowadays, what has happened? Not a single manufacturing organization except a one or twice small scale industries are participating in MBA and QA. It is the healthcare which has kept it still alive, kept it relevance to some extent. So me and my co-researcher in USA, Dennis Leonard, conducted a survey as to why this is happening. And the survey findings have been published in a peer-reviewed journal, and NIST in their blog has mentioned that they have referred our study in order to reflect on why MBA and QA is no more popular. So there are people, they say that in USA there are many regional quality awards, so people do take part, but that cannot justify a complete absence of participation by the manufacturing industry in Malcolm Baldrige National Quality Award. So there is a doubt to what extent it is giving benefit to the organization. Extant literature does not have. On the contrary, you will get evidence contradicting this. Let's take the Six Sigma. The average life of Six Sigma initiatives in a company is 3 to 4 years. When I talk about Six Sigma, I am not mentioning about Six Sigma DMAIC projects. A single project may be a great project. But when you deploy Six Sigma throughout the company with a massive training, use huge expenses, I talk this as a rolling out of the initiative company wide. Does it give any positive effect on the outcome? There is a great management expert, might have done some great job, was contributing everything which has been done, which has been achieved by his company is through the Six Sigma, and many have influenced by these executives' writings, lectures, supported by high profile consultants, even I myself has done. But later on it has come out in the literature, the most of the claims are false. There is no evidence that Six Sigma, whatever benefit has been come, might have come from some other initiative, some other factor, not due to Six Sigma. There are many examples. So this has raised a question in the academic mind that should a management go for evidence-based management, and it is now being taking place. Globally, there are 50 institutes, great institutes, who teaches at least one course on evidence-based management. There are a few who offer a program, certification program on evidence-based management. Why I am telling that MBA students must be exposed to? Because that is the formating age as a professional manager, and we are giving them various concepts. Since I am exposed to the concept of evidence-based management, in my class I always tell that, I always caution that whatever I am telling and whatever any experts telling, don't accept blindly. Don't accept blindly. Put your mind into it, examine critically. So, and we call we in MBA institutes, we in good reason is there that all MBA institutes invites practitioners, and we generally call best practice, sharing of best practice. Now, is this the best practice which is being told, giving the result? How the cause and effect relationship has been established? How the comparison is being done with the past under similar business conditions? How you have nullified while judging the benefit, present benefit, due to some other intervention, some other business scenario which is supporting or benefiting the organizations? There is not. So you must, I am not telling that they are telling wrong things, no. So as a management scientist, you must keep in mind, we will talk about it. So evidence-based management does not speak about always that the true evidence, we call it best possible evidence. Now what is best possible evidence? What we are seeing now in the case of COVID-19, this is a very big good example to explain the idea of best possible evidence. When the scientific community started, or medical community started treatment of COVID-19, there is no drug. So people thought, experts thought, that hydroxychloroquine will be an appropriate drug. So there is a big demand of hydroxychloroquine without any proof. And later on, it has been found that there are side effects. There is no proof of hydroxychloroquine. Still, it is being used as a prophylaxis administered to the medical professionals, those who are involved in treating the patients. There are other sorts of treatment like antibody treatment, other medicines, but again all these trials are going on across the world, and people are gathering informations and changing the policies. Even in India, we used to earlier, it has been talked of, it has been advised that all people must be quarantined. Now it is being told, based on these evidences, that no need. Initials, asymptomatic patients, positive patients may be quarantined at home. Even now it is being thought to release the patient after 10 or 15 days when the first test is coming negative and symptoms are very few symptoms or no symptoms, and there is no fever for last 3 days. Release him from the hospitals and let him be quarantined at his home for 2 weeks under supervision, under observations, so that the benefit is that hospital load may come down without risking the patient's life. So this is best possible evidence. So best possible evidence is a dynamic in nature. Certain it is happening in medicine also. Certain drugs are being withdrawn. In some countries, in some it is not. Like you can talk about many medicine. Let me not talk about unknown medicines. I am not a physician. No, so medical professionals are taking clinical judgments. So one may argue that experienced professionals' judgment is evidence. Yes, no doubt about it, is evidence. But what is the quality of the evidence? That is being questioned. One thing we must see, we must keep in mind that experience as such does not give you any knowledge until and unless you get proper feedback. So a physician get the feedback by treating a patient, and then take an informed call. So, like this feedback, his knowledge is getting increased. But what is happening in management science? What management science? If you take an if you make an intervention, the initiate that no, you don't get the evidences immediately. It comes. There is a considerable lead time. It comes after some time. By the time the expert may not be in his role, or even may not be in his organization. Take the case of mine. Half of my life I have spent on designing of incentive scheme and manpower assessment. But if someone asks me that how effective incentive schemes are in improving the productivity of an organization in long term, I do not have any evidence, barring a few cases where a particular organization approached the organization where I was working to revise the incentive schemes after 2 years or after 3 years, after 1 year. Here I can, with a reasonable confidence, I can tell that there must be some benefit, otherwise they would not have come. But such incidences are very few. Now, medicines have got side effects. We don't talk about any side effect of any management practice. It is not being talked about. You don't know. I have worked as a consultant. I have worked as in corporates. Your management techniques, what you want to giving too much emphasis from the top management, and all on a sudden, and I stress on that, all on a sudden management withdraws. I have seen. So what is the motivation level of the executives? The time and money the company has put, and what is the faith or trust of the executives on management techniques? All are questionable. It is not coming to the surface. Nobody is telling this openly, because the ideas has come from the high profile consultant or or from the chairman or from the top management, okay, any other top management. And when we have accepted it, we accept it because of these false claims in many cases, and from here listening to very many high profile consultants or executives. This is a bias, and it has been recognized as a bias, cognitive bias, known as HIPPO. What is HIPPO? Highest paid person's opinion. This term has been coined by an Indian originated person, some Kaushik, I don't remember the title. So when we expose our MBA students in their formatting age with different ideas of management techniques, we must tell them that you critically examine the claims. Otherwise, if the claim is not true, it will be influencing, it will get implanted in your subconscious mind. It will be influencing you in future in taking decisions. Just imagine, there is no scientific evidence on motivation Maslow's hierarchy, laws of motivation theory of a hierarchy of needs. There is no such evidences. Hawthorne experiment. The current experiment result shows that the effect is not there. Even they have analyzed the data, and the claim what was been made in Hawthorne experiments originally, it was exaggerated. It was not. It was the effect size was not that much. But still we are teaching these techniques in our management, in our B schools around the world. India is not an exception. So, in short, all managers, or particularly the MBA students, we should tell them examining the claims, whatever you are reading in textbook, in papers, and in listening to the experts. 3. What is the claim? Be aware of the claim. Is the claim too true, too big to be true? On what basis it is being told? What is the validity? Then see that fairness, how fairly it has been compared. When I claim that I did Y in company B and it gave me result, I always compare it to the past when Y was absent. But when I did B, there is a change in the business environment, company scenario. Company might have taken a lot of other decisions. Because of that, I might have got the benefit. And now I am attributing this to the initiative Y. Could be. So what I am telling that people must have a healthy skepticism. I am not telling they are wrong. I am not telling that textbooks are wrong. I am not telling that papers are wrong. Quality of the evidence. Quality of the evidence. So evidence comes from 4 angles. One is that evidence comes from expert opinion is general. Yes, there is an evidence and we have talked about it. Stakeholder, organizations data, and scientific papers. It has been seen that globally the management practitioners does not read scientific papers. There is a big gap. Evidence-based management will help in bridging the gaps. If they are exposed, they will be inquisitive to go through what the literature, what the journals or peer-reviewed papers are telling on the same subject. People will people will look for evidences. So that kind of healthy criticism we want to create, and we should create in the mind of the budding managers. And then 2 things we have seen. Then you see that that take care what is your takeaway. That means, is it relevant in your situation? Can it be applied in the problem you are thinking of? Are you sure about its negative effect? Is the side effect is bad than the main effect? And always you find that in management science, nobody talks about any bad effect. But I can't give you hundreds of examples of bad effect of failed initiatives. If you want to know more about evidence-based management, wonderful site is there, organization, Center for Evidence-Based Management. And evidence-based management is now very widely applicable in economic policy decisions. This year, Nobel Prize has been awarded to an experimental economist. That does not mean that this has been done the first time. No. Evidence-based policy making are in vogue for quite some time. It is already in place. Campbell collaboration, there is a open access journal which gives you enough examples of application of evidence-based management in policy decisions, socio-economic policy decisions. There is an organization called Innovative Growth Lab. They are doing huge experimentation on social policy decisions. So you should be inquisitive. I hope that this talk will create an inquisitiveness in your mind to go know more about evidence-based management. If you like this, give me a thumbs up, or if you have separate opinion contrary to what I am telling, please write it in my comment section with specific comments. That will help me to improve further. Thank you very much.